Let's react to Theo Vaughn's video on FUE hair transplants.
Oh, I got the hair. That's what's been going on. I'm like, what if I haven't been doing much? I got the hair rejuvenation again. So, you know, I love surgery and I got it.
Most people don't actually love surgery. They hopefully like the outcome of the surgery, but they don't necessarily like to get surgery. And we have a video on why people actually get hair transplants. So make sure to check that one out.
I've been having to chill. That's been the worst thing. I've been having to literally do nothing.
Yeah, there are some physical limitations that we put on people after their hair transplant to make sure that the grafts survive and that their overall recovery is as smooth as possible. So generally speaking, the first week, you really don't want to be sweating. So any type of movement that can lead to sweating or being in a situation like a hot space that might make you sweat is not a good idea. After the first week, light activity is permitted. Some people interpret that as even some light exercise, and usually that's okay after a week as long as it's not, super heavy duty. And after 2 weeks is when we instruct our patients to go back to pretty much doing any type of physical activity that they choose other than swimming and sauna. For that, we recommend waiting about 3 weeks before you resume that type of activity.
They took it out the back. They took a decent crop and they put it up in that front, boy.
Yeah, the classic donor area for hair transplant is the back of the head. We call it the occipital scalp, and sometimes we also take from the sides and we call that area roughly the parietal scalp. So the occipital parietal region is the classic donor zone.
Hair in the back, hair in the front. So, but it take a while. They just take the seed. Now, a lot of people do not know this.
And what he means is that they probably shaved this whole head and they took the hairs real short. So there is this concept of long hair FUE, and we've spoken about it in a recent video. But it's good to know that there's another way to do this, right? With the long hair FUE, you don't have to cut the hair short and then extract it out. You could extract out long hair. You just need a specialized punch in order to make that happen.
So what they do, they shave the back.
So remember, no shave FUE is possible. In my practice, I like to do no shave in the right situation, so it cannot be like a really large procedure. So we usually up to about 1,500, maybe 1,600, will offer the no shave if and when the patient wants that. It's usually at a higher cost because it's more labor intensive. It's not something that everyone offers. So that's the no shave FUE. Now, the hair that we actually take, we still trim before the extraction process.
They take about maybe 1 out of every 12 hairs out of the back, or 30 hairs or something. Dig it out. They have a little bitty, it's not like a shovel, but it's pretty much like a little bit, like a little, Uncle Baby Billy shovel.
It's a punch, and they used to be handheld mechanical type punches where you would literally just like go in and like twist the instrument. So that's kind of old school. Nowadays we have more motorized type of hand pieces that oscillate and do interesting things where you can adjust the depth and the type of punch that you're using, and the punches have different designs so that they're less traumatic on the bulb of the hair follicle, so that it's a safer type of harvest, that your regrowth rates and your survival rates are higher. So all of that is some of the newer tech, I would say, over the last maybe 8 to 10 years in FUE surgery. There's also a robot that does this stuff. I don't like the robot, as many of you know, and we have an older video where I talk about a lot of the disadvantages of the robot, and as far as I know, I don't think the robot people have done so much to advance that technology yet. So we'll see over the years to come. Perhaps they make it so exciting and so much better than the classic ways that we do FUE harvesting. We'll see, but currently I would say the robotic system is not the state of the art for optimizing the scarring in the donor area and also just overall optimizing efficiency of surgery.
I mean, they just run through the house with a pickle in their mouth, pulling hairs out of your dome, out of your back dome, back of your head. So they pull them out, and then they dig little bitty holes in the front.
So he's talking about the recipient site making. And yeah, sometimes that's done with little tiny blades that we custom cut in my practice. And sometimes it's done with actual needles. So it just depends on whatever people are comfortable with. There's also the DHI method, which is implanter pens. And we have an older video that talks about the DHI technique. It's not better than any other technique, but it is just one other technique that can be used for recipient site making. And keep in mind that the DHI method with the implanter pen pens, they can sometimes come sharp and they can sometimes come dull. So the sharp ones are where you like enter the skin with the implanter pen and basically like kind of inject or press down on the plunger, and that deposits the graft into the site. The other way to do it is to have pre-made sites, which is how I do my recipient site making. And then you take the dull tip of the implanter pen, place it into the site, and then also release the graft. So that's basically a different style than using forceps to place grafts. And some people argue one is better than the other, but in reality, in the right hands, it doesn't really matter which method you use. Both can yield good results. Both can also yield bad results if it's not done properly.
Take the hairs from the back, put them in the front. And that's how it goes. Took about 4 or 5 hours.
Yeah, it can take longer than that. Depends on the size of the surgery, depends on the size of the team, the attention to detail from the surgeon and the team, and then of course the experience of the team. Sometimes it becomes difficult, I think, to assess, especially from a patient's perspective. If it was a shorter procedure, was it shorter because everything went just great and they're going to have an amazing result? Or was it shorter because, the team sort of cut corners and didn't really, pay attention to the details and do meticulous work, and that's why it didn't take too long? Equally, when it's a long procedure, is it because the team wasn't experienced and they didn't know what they were doing, so everything took forever? Or is it because the team just really took their time and didn't rush and wanted to do everything possible to get an A+ result, and maybe there were some issues with bleeding, or the grafts were more difficult to handle, or the angles were more complicated that led to a longer length of procedure? It's very difficult, I think, for the patient to sometimes tell. So again, it comes back to when you're choosing a clinic, and specifically a surgeon, make sure that you're going to someone reputable who has nice results that you've seen on their website, on the internet, that they overall have nice reviews, that they just have like a pretty strong reputation in the field, and that they really know what they're doing, and that you feel comfortable with them, and that they have, of course, like a good artistic vision, since this is aesthetic surgery. So all of that matters, and then you just trust that if things took a bit longer, or if it ended sooner than expected, that everything was still done properly. But when you're going to some unknown place, unknown clinic, unknown doctor, you don't know anyone there, you don't know, what the reputation there is, then how are you going to know how to interpret whether it was a 4 to 5 hour surgery, and if that's okay, or if it was an 8 to 10 hour surgery, if that's okay, right? It's going to be hard to know.
I started watching El Camino, and then I woke up like an hour and a half later, and I was in watching a soap opera, so I don't even know what the hell happened.
Some patients are actually put to sleep for hair transplants, like with IV sedation, but we don't do it that way. We stick to just oral sedation, but some people just get it with local anesthesia, so lidocaine alone, and no PO sedation like with Valium or Ambien. But most people will take an Ambien or Valium or both to just basically kind of soothe the nerves, and that seems to help. But even if they just have oral sedation, they might fall asleep, and then, if they're watching a movie, they might wake up and be like, oh, now there's another movie on. So that's possible.
So I did that dirty trick and now it has been recovering. The hard part is you can't do anything active. So you can't do gym, you can't do yoga. You have to sleep at a 45-degree angle.
That's a bit steep. Most people, we recommend about 30 degrees. You definitely don't want to be flat because of swelling, because of just, overall kind of precautions to prevent graft displacement. I think 45 degrees is a bit of an overkill. You can be a little flatter than that. But yeah, there are some general restrictions and recommendations to make sure that, you get the optimal result after, spending all the money and going through surgery. The key thing after surgery is really just not to disrupt your grafts. So not to physically kind of rub them out. I see patients sometimes, right after surgery reaching for their heads, and I'm like, no, don't do that unless you're like looking in a mirror, because you don't want to, knock the grafts out, because then they're gone, then they won't grow. Everything else really boils down to like the quality of the actual surgery, less so on whether you sprayed every single 30 minutes or every hour, or if you forgot to spray for, a couple times. Like that stuff, that's not what makes the biggest difference. It's really what was done during surgery, and then making sure to avoid manually displacing your grafts afterwards. After about 72 hours, the grafts are fairly secure and are difficult to knock out.
But yeah, you sleep at a 45-degree angle, like a semi-alert person, I guess. Like somebody who sleepwalks but is lazy, so they're not even doing it. So that's the tough part. You got to stack the pillows at a certain angle. You got to get the ruler, or you can do a thing on your phone now that shows you what angles are?
It does not have to be a perfect 45-degree angle. There's no study out there in the literature that supports an exact 45-degree angle, or else, the surgery doesn't work. That's not how it goes. So it's good as a general kind of guideline, but it's not like you don't have to follow it, to a T, especially that specific instruction that he's talking about. And a neck pillow can be helpful for just overall comfort when you're trying to limit your movement during sleep.
And today was the first day I could wash the back of the hair and just pour a little water on the front. And that's been 6 or 7 days, 6 days.
So yeah, again, every clinic has their own way of doing it. As far as how we will instruct patients for post-op care, the day after surgery, they can generally spray the area. Unless we're doing eyebrows and beards, then we keep it dry till day 6. But for scalp cases, they spray the following day with the same solution that the grafts were bathing in during surgery. So that's the solution we give them for post-operative day 1. So about 48 hours after surgery, they can do their first basin wash. So what that means is that it's like warm water in a bowl with baby shampoo, and they're literally gently pouring it over their heads in like a bathtub. And then the drying process is just like kind of open to air dry. So there's no rubbing on the grafts. There's really no contact with the grafts other than the warm water and the baby shampoo. But we don't recommend waiting 5-6 days to start that process. That starts 2 days after surgery and then basically continues each day after that until day 6 when the first shower is permitted, in which case the shower current is hitting the grafts and you're basically mechanically working out the crusts that are in the recipient zone.
On Tuesday, I'll be able to resume, I think, some yoga and some just moving around. But it sucks because you get stagnant. And that's what hasn't been good for me. I don't like being stagnant.
Well, it's important to move around. So you can go on walks and you can do movements around, the house. You just don't want to be working up a sweat. So there's still plenty of things that can be done. And you have to be careful with some of the head movements and, making sure not to contact anything with your head. So there are some limitations, but you shouldn't be just sitting in bed. That's not good for recovery. It's not good for your circulation. You don't want to get a blood clot sitting around all day on the couch for a week recovering from a hair transplant. That would be a terrible thing, right? So yeah, some movement is fine.
The world can get me more when I'm not moving.
Yeah, because he probably has more time to be with his thoughts and maybe have sometimes some negative thoughts, and then you're not able to then kind of get around and push through those thoughts into something more positive. And I know that I'm like that too sometimes. I need to be constantly doing things and occupying myself. So I get where Theo's coming from with this.
And that's why I think it's just with this time of year and this much energy in the air, it's like, man, I just want to get moving again so I can, get out of some of these shadows and stuff.
Yeah, some people ask me, what's the optimal time of year to get a hair transplant? And in reality, there's no right answer, right? People get hair transplants all around the world in all types of different climates. So I don't think there's some optimal, climate that you need to be in or a time of year. But what I tell people is you just want to be optimized for just your general health, but also the time of year, maybe with regards to work or family life when you have time to recover. And so maybe the time that he had it done, maybe it wasn't optimal for him. I don't know. But that I think is really more important than the actual climate that exists around you as far as the actual weather. But all those other factors should be taken into consideration when trying to find the optimal time to actually have your hair transplant.
So yeah, I got the FUE hair transplantation. It's my second time. Did I need it? Probably not.
No one needs this stuff, right? It's all elective. So this is all just something that hopefully enhances your life, but it's not something anyone truly needs, right? This isn't like a life or death thing, but it can truly help people and make them feel more confident, which is a big driving force, I think, for people to get this type of work done. But, this is, his second time getting the FUE surgery. So the question is, did they work into a new area this time? Or maybe they were looking to enhance the density in the original area of where they worked. That's sometimes possible too, right? So the key is to make sure that the first surgery was executed properly. So if you're just going back to build up the density and to just put more grafts, that's fine, as long as you've, waited enough time time for healing and to see the results from the first surgery. Or you can sometimes work into a different area. So sometimes patients will come in, we'll do the frontal area, and then they say, oh, but what about the back? So of course that is something that we can tackle, but usually requires, multiple surgeries if the initial area is large enough, because, there's only so many grafts that we can safely do in a day. And it's sometimes better to just kind of divvy up the cases rather than doing, 6,000 grafts in a day. I've spoken previously about these kind of more Hail Mary attempts at hair transplants. There are a couple of people around the world who do them really well, but I would argue that most people who offer these giga sessions, very, very large sessions of tons of grafts, 6,000, 10,000 grafts in a day, or even over the course of 2 back-to-back or consecutive days, most do not do it well. And then you have a lot of depletion of your donor area with very few attempts to do anything else with your hair if you weren't in love with your initial results. So it's not my preferred approach. Again, with very, very few exceptions out there, I think you're more likely to create more problems than to generate some marvelous results with these very, very large giga sessions.
They inject your scalp with a bunch of different saline solution and a bunch of stuff to numb the pain.
Lidocaine for short acting type of anesthesia, quicker onset, and it also doesn't last as long compared to Marcaine, which takes longer to start working, but it lasts for longer. So they're very complementary. Those are the two main anesthetic agents that we use during a hair transplant.
Well, this junk starts at the second day and third day. You don't notice it, but then on the fourth day, your forehead swells up. Then the swelling rolls down your face. And you start to get swollen around your eyes, nose, cheek.
Yeah, so the swelling is a pretty normal type of phenomenon anytime you're getting work done by the frontal scalp, or maybe even mid-scalp, or the temples too. But once the work is moved more posterior, so if you're transplanting into the crown, that drainage, or the lymphatics, right, that drain the swelling, that happens posteriorly, so running to the back of the head, so you don't get the swelling on the face. But anytime we're doing work towards the frontal area, then of course it's possible that you'll see this swelling develop on the forehead, and then that drifts down into other parts of the face. By about 6 to 7 days, it pretty much is completely gone and just dissipates on its own. I don't recommend any like icing or anything like that. I don't recommend high dose steroids that just continue for a week. That's usually not a great idea because of the risks of high dose steroids for a week. But some of the swelling on the face can be quite dramatic. I've had some patients, very few, but sometimes an entire eye can swell shut. So just realize that there is a spectrum of how much swelling people get. And although we include Kenalog, which is a steroid, in the mixture of the stuff that we inject into the scalp, even that is not enough to fully eliminate more significant facial swelling for some people.
I'll include some photos. I look like a fire boy, a boy that had been maybe not in a fire. Well, maybe like a boy who'd been in like a medium kind of fire.
Well, Theo Von has been in the hair transplant fire, and that says something.